What if I told you that the very pills sitting in your medicine cabinet right now, the ones you take every single day without even thinking about it, could be quietly increasing your risk of having a heart attack or a stroke? And what if I told you that millions of people over the age of 60 are taking these medications completely unaware that they could be doing more harm than good? I know that sounds alarming. I know that might even sound a little bit scary. But stay with me here, because this is one of those conversations that could genuinely save your life or the life of someone you love. Hey everyone, I'm Dr. Michael Health and welcome back to the channel. If you're new here, I'm a cardiologist and I've spent decades helping patients understand what's really going on inside their bodies, especially when it comes to the heart. And today I want to have one of the most important conversations we've ever had on this channel. We're going to talk about 5 incredibly common pills that many people over 60 are taking regularly, sometimes daily, that have been shown to raise the risk of heart attack and stroke. And I'm not talking about obscure medications that nobody's ever heard of. I'm talking about pills that you can buy over the counter at any pharmacy. Pills that your doctor may have prescribed without giving you the full picture. Pills that you might consider completely harmless because you've been taking them for years. Now, before we dive in, I want to be very clear about something. I am not telling you to stop taking any medication right now. That would be irresponsible, and that is not what this video is about. What this video is about is awareness. It's about education. It's about empowering you with the knowledge you need so that you can have a real, informed conversation with your own doctor about what you're putting into your body every single day. Because here's the thing that frustrates me as a cardiologist. Most people over 60 are on multiple medications. Some of my patients come in and they're taking 8, 10, sometimes 12 different pills a day. And when I ask them, do you know what each one of these does? Do you know the side effects? Do you know how they interact with each other? Most of them look at me and say, no, my doctor just told me to take them. And that's a problem. That is a real problem, because when you're over 60, your body processes medications differently. Your liver doesn't metabolize drugs the way it did when you were 30. Your kidneys don't filter things out as efficiently. Your heart is more sensitive to certain chemical changes. And that means medications that might have been perfectly fine for you 20 years ago could now be putting you at serious risk. So, let's get into it. Let's talk about the first pill that I want to bring to your attention. And this one is going to surprise a lot of you because almost everyone has taken this at some point in their life. I'm talking about non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. Now, you might not recognize that term, but you definitely recognize the names: ibuprofen, naproxen, brands like Advil, Motrin, Ailey. These are some of the most widely used medications on the planet. People take them for headaches, for back pain, for arthritis, for joint stiffness, for basically any kind of pain or inflammation you can think of. And because you can buy them over the counter without a prescription, most people assume they're completely safe. They think, well, if it were dangerous, they wouldn't sell it at the grocery store, right? Wrong. Dead wrong. Here's what the research tells us. Multiple large-scale studies, including a major meta-analysis published in the British Medical Journal, have shown that regular use of NSAIDs significantly increases the risk of heart attack and stroke, particularly in people over the age of 60. And when I say significantly, I'm not talking about a tiny little bump in risk. Some studies have shown that regular NSAID use can increase your risk of a heart attack by as much as 20 to 50%. Now think about that for a second. You're taking a pill for your knee pain and you're increasing your chance of having a heart attack by up to 50%. That is staggering. And the reason this happens is because NSAIDs affect the way your body handles sodium and water. They cause your body to retain more fluid, which raises your blood pressure. They also interfere with the protective lining of your blood vessels, making it easier for blood clots to form, and they can reduce the effectiveness of other heart medications you might already be taking, like blood pressure drugs or blood thinners. So you've got this perfect storm where the medication is raising your blood pressure, making your blood more likely to clot, and undermining the other medications that are supposed to be protecting your heart. And the scary part is that this increased risk can kick in within just the first few weeks of regular use. You don't have to be taking these for years to be in danger. Now, I see this all the time in my practice. I'll have a patient come in with elevated blood pressure that we can't seem to get under control. And when I dig into their medication list, I find out they've been taking ibuprofen every day for their arthritis. And when we take them off the ibuprofen or switch them to a safer alternative, their blood pressure comes down almost immediately. It's that direct of a connection. So, if you're over 60 and you're popping ibuprofen or naproxen on a regular basis, please talk to your doctor about alternatives. There are safer options for managing pain. Things like acetaminophen, which is Tylenol, topical creams, physical therapy, even certain supplements like turmeric or omega-3 fatty acids that can help with inflammation without putting your heart at risk. The key is to have that conversation and not just keep reaching for the bottle every time something hurts. Now let's move on to the second medication, and this one is really important because it affects tens of millions of people worldwide. I'm talking about proton pump inhibitors, or PPIs. These are medications like omeprazole, which you might know as Priloc, lancoprol, which is Prevacid, esomeprazole, which is Nexium, and pantoprazole, which is Protonix. These drugs are designed to reduce the amount of acid your stomach produces, and they're prescribed for conditions like acid reflux, GERD, stomach ulcers, and heartburn. And just like NSAIDs, many of these are available over the counter, which gives people the false impression that they're harmless. Now, I want to be fair here. PPIs are incredible medications when used properly and for the right amount of time. If you have a bleeding stomach ulcer or severe esophageal damage from chronic acid reflux, PPIs can be life-saving. The problem is that these medications were designed for short-term use, typically 4 to 8 weeks. But millions of people end up taking them for months, years, sometimes even decades. And that's where the danger comes in. Several studies, including research published in the journal Circulation and a large study from Stanford University, have found that long-term PPI use is associated with a significantly increased risk of heart attack. One study found that PPI users had a 20 to 30% higher risk of experiencing a cardiovascular event compared to people who weren't taking these drugs. And the mechanism behind this is fascinating and frightening at the same time. PPIs appear to interfere with the production of nitric oxide in your blood vessels. Now, nitric oxide is absolutely critical for cardiovascular health. It's what keeps your blood vessels relaxed and dilated, allows blood to flow freely, and prevents your arteries from becoming stiff and narrow. When PPI use reduces nitric oxide production, your blood vessels start to constrict, blood flow becomes restricted, and the risk of a heart attack goes up. But that's not all. Long-term PPI use has also been linked to magnesium deficiency, and magnesium is one of the most important minerals for heart health. It helps regulate your heart rhythm, supports healthy blood pressure, and plays a role in preventing blood clots. When your magnesium levels drop because of chronic PPI use, you become more vulnerable to arrhythmias, which are irregular heartbeats that can sometimes be life-threatening. I've had patients come into my office with heart palpitations and irregular rhythms. And after running their blood work, we discover their magnesium is dangerously low, and it's directly connected to their long-term use of PPIs. So if you've been on a proton pump inhibitor for more than a couple of months, I really encourage you to have a conversation with your doctor about whether you still need it and whether there are alternatives Simple lifestyle changes like elevating the head of your bed, avoiding late-night eating, reducing spicy and acidic foods, and losing a little bit of weight can often manage acid reflux just as effectively as medication without the cardiovascular risks. All right, let's talk about the third medication on our list, and this one might be the most controversial, because it's one that's prescribed very liberally, especially to older adults. I'm talking about certain types of antibiotics, specifically a class called macrolide antibiotics. The most well-known one in this group is azithromycin, which most people know as the Z-Pak. Now, the Z-Pak is one of the most commonly prescribed antibiotics in the world. Got a sinus infection? Here's a Z-Pak. Got bronchitis? Here's a Z-Pak. Got a mild respiratory infection that might even be viral and wouldn't respond to antibiotics anyway. Here's a Z-Pak. Doctors hand these out like candy. And I understand why. They're effective. They're easy to take. It's only a 5-day course, and patients love the convenience. But here's what a lot of people don't know. Azithromycin and other macrolide antibiotics have been shown to increase the risk of sudden cardiac death, heart attacks, and dangerous heart rhythm abnormalities. A landmark study published in the New England Journal of Medicine found that patients taking Athromy had a significantly higher risk of cardiovascular death compared to patients taking other antibiotics or no antibiotics at all. And the risk was particularly elevated in people who already had existing heart conditions, which describes a huge portion of the population over 60. The way this works is that macrolide antibiotics can affect the electrical system of your heart. They can prolong something called the QT interval, which is essentially the time it takes for your heart to recharge between beats. When the QT interval gets too long, it can trigger a dangerous type of arrhythmia called torsades due, which can lead to sudden cardiac arrest. And when you combine Athromy with other medications that also prolong the QT interval, which many older adults are taking, the risk multiplies. Now, I'm not saying you should never take azithromycin. There are situations where it's the right antibiotic for the job, but what I am saying is that if you're over 60, especially if you have any kind of heart condition, high blood pressure, or if you're taking other medications that affect your heart rhythm, you need to make sure your doctor is aware of all of this before prescribing you a Z-Pak. There are often alternative antibiotics that are just as effective without the cardiac risks. And honestly, a lot of the time when people are prescribed a Z-Pak for something like a cold or a mild upper respiratory infection, they don't even need an antibiotic in the first place, because those infections are usually viral. So be your own advocate. Ask questions. Don't just accept a prescription without understanding what it could do to your heart. Now, the fourth medication on our list is one that surprises almost everyone when I bring it up, because it's something that people take specifically to feel better when they're sick with a cold or flu. I'm talking about decongestions, particularly pseudoephedrine and phenylphrine, which are found in common cold and flu medications like Sudafed, Dacquil, NyQuil, and dozens of other over-the-counter products. These medications work by constricting blood vessels in your nasal passages to reduce swelling and open up your airways so you can breathe easier. And that sounds great, right? The problem is that these drugs don't just constrict the blood vessels in your nose. They constrict blood vessels throughout your entire body. And when your blood vessels constrict, your blood pressure goes up. Sometimes it goes up a lot. For a young, healthy person, this temporary spike in blood pressure is usually not a big deal. But for someone over 60 who may already have high blood pressure, atherosclerosis, or other cardiovascular risk factors, this spike can be dangerous. It can push blood pressure into a range where a heart attack or stroke becomes much more likely. And many people don't realize this because they think of cold medicine as being completely benign. They take it when they're stuffed up. Maybe they take it for a week or two, during a bad cold, and they never consider what it's doing to their cardiovascular system the entire time. I've seen patients end up in the emergency room with hypertensive crises, meaning their blood pressure shot up to dangerously high levels. And when we trace it back, the culprit was over-the-counter cold medication that they took without a second thought. Pseudoephedrine in particular is so potent at raising blood pressure that it's actually kept behind the pharmacy counter in many places, not because of cardiovascular concerns, but because it can be used to manufacture methamphetamine. But the cardiovascular risks are just as much of a reason to be cautious with it. And phenylphrine, which replaced pseudoephedrine in many over-the-counter products, has its own issues. While it may not raise blood pressure quite as dramatically, recent research has actually questioned whether it even works as a decongestant when taken orally. So you might be taking a medication that's increasing your cardiovascular risk without even providing the benefit you're taking it for. If you're over 60 and you get a cold, talk to your doctor about safer ways to manage congestion. Saline nasal sprays, steam inhalation, staying hydrated, using a humidifier. These are all effective ways to relieve congestion without putting your heart in danger. And if you absolutely need a decongestant, make sure your doctor knows about your heart health, so they can guide you to the safest option. And now we come to the fifth and final medication on our list, and I saved this one for last because it's one of the most commonly prescribed classes of drugs for older adults, and the cardiovascular risks are often overlooked or minimized. I'm talking about certain antidepressants, particularly tricyclic antidepressants, and some selective serotonin reuptake inhibitors, or SSRIs. Now, I want to be very sensitive with this one because I know that depression and anxiety are serious conditions that affect millions of people, and medication can be absolutely life-changing for those who need it. I'm not in any way suggesting that people should stop taking their antidepressants. What I'm saying is that certain antidepressants carry cardiovascular risks that need to be carefully considered, especially in people over 60. Let's start with tricyclic antidepressants, or TCAs. These include medications like amitriptyline, noraline, and ipramine. While they're prescribed less frequently today than they were decades ago, they're still used particularly for chronic pain, migraines and insomnia in older adults. The problem with TCAs is that they have significant effects on the heart's electrical system. Like the macrolide antibiotics we talked about earlier, TCAs can prolong the QT interval and increase the risk of dangerous arrhythmias. They can also cause orthostatic hypertension, which is a sudden drop in blood pressure when you stand up, leading to dizziness, falls, and in some cases reduced blood flow to the brain. In older adults whose cardiovascular systems are already compromised, these effects can be serious and sometimes fatal. Studies have shown that TCA use in older adults is associated with an increased risk of heart attack, stroke, and sudden cardiac death. Now, when it comes to SSRIs, the picture is a bit more nuanced. SSRIs like fluoxetine, which is Prozac, sertraline, which is Zoloft, and citalopram, which is saline, safer for the heart than tricyclic. However, they're not without risks. Citalopram in particular has been flagged by the FDA for dose-dependent QT prolongation, meaning the higher the dose, the greater the risk to your heart rhythm. And for older adults, the FDA has actually recommended a maximum dose that's lower than what's recommended for younger adults, specifically because of this cardiac risk. SSRIs can also interact with other medications that older adults commonly take, including blood thinners like warfarin, which can increase the risk of bleeding, and other drugs that affect serotonin levels, potentially leading to a dangerous condition called serotonin syndrome. The takeaway here is not that you should be afraid of antidepressants. Depression itself is a risk factor for heart disease, so leaving it untreated is also dangerous. The takeaway is that if you're over 60 and you're on an antidepressant, or if your doctor is recommending one, make sure you have a thorough discussion about the cardiovascular implications. Make sure your doctor knows every other medication you're taking so they can check for interactions. And make sure you're being monitored appropriately with regular checkups and, when necessary, EKGs to keep an eye on your heart rhythm. Now, I want to take a step back and talk about the bigger picture here, because I think there's a really important lesson in all of this. We live in a culture that has become incredibly reliant on pills. We've been conditioned to believe that there's a pill for everything, and that taking pills is always better than the alternative. Got pain? Take a pill. Got heartburn? Take a pill. Got a stuffy nose? Take a pill. Feeling sad? Take a pill. And look, medications are incredible. Modern medicine has given us tools that save lives every single day. I'm a doctor. I prescribe medications, and I believe in them when they're used appropriately. But the key phrase there is when they're used appropriately. The problem is that as we get older, the number of medications tends to pile up, and each new pill adds another layer of risk. Drug interactions become more complex, side effects become more pronounced, and the cumulative burden on your body, particularly your heart, your liver, and your kidneys, becomes significant. This is something we call polypharmacy in the medical world, and it's one of the biggest challenges in caring for older adults. Every time I see a new patient over 60, one of the first things I do is review every single medication they're taking and ask myself, is this still necessary? Is the benefit outweighing the risk? Is there a safer alternative? And you know what? More often than not, I find at least one or two medications that we can either reduce, replace, or eliminate entirely. So, here's what I want you to do after watching this video. I want you to take a look at every medication you're currently taking, whether it's prescribed or over the counter. Write them all down. And at your next doctor's appointment, bring that list and have an honest conversation. Ask your doctor, do I still need all of these? Are any of these putting my heart at risk? Are there safer alternatives we could try? Are any of these interacting with each other in ways that could be harmful? You deserve to know the answers to these questions. You deserve to be an active participant in your own health care, not just a passive consumer of whatever pills get handed to you. And I also want to encourage you to think about the lifestyle changes that can sometimes reduce your need for medication altogether. Regular exercise, even just 30 minutes of walking a day, can lower your blood pressure, improve your cholesterol, boost your mood, reduce inflammation, and strengthen your heart. A heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can do more for your cardiovascular health than many pills ever could. Stress management through meditation, deep breathing, spending time with loved ones, or engaging in hobbies you enjoy can lower cortisol levels and reduce the strain on your heart. Good quality sleep, 7 to 8 hours a night, gives your heart the rest it needs to function properly. These aren't just nice things to do. These are powerful, evidence-based interventions that can transform your health and potentially allow you to reduce or eliminate some of the medications you're currently relying on. Now, I know this has been a lot of information, and I know some of it might feel overwhelming or even scary, but I want you to leave this video feeling empowered, not frightened. Knowledge is power, and now you have knowledge that most people don't. You know about the cardiovascular risks of NSAIDs, proton pump inhibitors, certain antibiotics, decongestants, and certain antidepressants. You know why these risks are particularly dangerous for people over 60. And you know what steps you can take to protect yourself. That puts you ahead of the vast majority of people out there who are taking these medications blindly without any idea of what they could be doing to their hearts. If you found this video helpful, please do me a favor and hit that like button. It helps this video reach more people who need to hear this information. And if you haven't already, subscribe to this channel and turn on notifications so you never miss a video. I put out content like this regularly because I believe that when you understand what's happening inside your body, you make better decisions about your health. And better decisions lead to a longer, healthier, and happier life. Share this video with someone you love, especially if they're over 60 and taking multiple medications. You could be sharing information that literally saves their life. And drop a comment below. Let me know which of these 5 medications surprised you the most. I read every single comment. And I love hearing from you. Your questions and your feedback help me create content that matters to you. And that's what this channel is all about. This is Dr. Michael Health reminding you that your heart is the engine that keeps everything running. Take care of it. Question what goes into your body. Be your own advocate. And never stop learning about how to protect the most important muscle you have. I'll see you in the next video. Take care of yourselves and stay heart healthy.